stand with you, Wuhan. Don't give up. What you just heard was a magical composition penned down by a Belgian composer to salute the efforts of the doctors, medical staff, and the Chinese people in combating the deadly new coronavirus. Health officials in China are calling on recovered coronavirus patients to donate blood. This after seeing an improvement in a trial group of patients injected with blood plasma containing antibodies that fight the new virus. Take a look at this.
医院已经有4名患者接受过恢复期康复的病人的血浆的治疗。目前呢，短期内我们看到有向好的迹象，病人呢的生命体征得到了稳定，精神状态也得到了改善，血氧得到了稳定，这是我们看到的一些积极的一些变化。任何一个治疗呢都有一定的风险，因为它是输入的是别人的血浆，所以呢里面有过敏和其他的一些不确定的因素。但是呢，在一个救命的环境下面，在一个重症病人的救治方面，这是一个必要的一个选择。目前呢，主要还是用于重症患者、危重患者或者极其危重的患者。捐献血浆呢，它是一个日常的一个正常动作。对于刚刚从疾病当中恢复的病人来说呢，如果是一个轻症患者或者是一个普通型的新冠肺炎的患者康复以后，捐献血浆对他来说没有什么影响。我们建议呢，还是2周以后的康复者参加这种捐献，保证他里面的体内的病毒得到很好的一种清除。
Now, China has declared an all-out, quote-unquote, people's war to tame the coronavirus outbreak. More than 760 million people have now been quarantined. That implies that nearly 10% of the world's population is now under a stringent lockdown. Villages and cities are flooded with battalions of uniformed volunteers and political representatives carrying out the biggest social control campaign in the history of China for a singular goal: to keep millions of possible hosts of the COVID-19 virus isolated. China, through President Xi Jinping's own admission, is in a wartime battle with the coronavirus pandemic, a social control blanket, the likes of which were only seen in the Mao Zedong era. Residential lockdowns of varying strictness from checkpoints at building entrances and on the streets have quarantined more than half of the country's population, totaling up to 760 million. Yes, you heard that right. 10% of the world's population has now been put under an infinite quarantine period. Many public places are in a virtual freeze in China. Beijing's prevention efforts are led by its myriad neighborhood communities. The government's grid management system is keeping a close watch and a tighter grip over the Chinese population. The authorities are combining enormous manpower with mobile technology to track people who may have been exposed to the virus. From moderate to severe, China has imposed different policies varying from city to city for fending off the epidemic. But the question is, has China's quarantine strategy been able to contain the outbreak? The new coronavirus has already claimed 1,665 lives, with nearly 69,000 people battling the infection in mainland China. Now, are the overbearing measures of China backfiring? And more importantly, is China scaring the infected people into hiding and making the outbreak even harder to control? These questions, despite the scale of the outbreak, still remain unanswered. Now, the coronavirus-triggered shutdown in China has sparked fears of a drug shortage in India. This as the lockdown has impacted the production and import of raw materials of active ingredients used in making medicines. According to a report by the Federation of Indian Chamber of Commerce and Industry, or FICCI, 70% of India's bulk and intermediary drugs come from China. The report has warned that medicine supplies may not last beyond the month of February. Prices of some drugs will shoot up if the shutdown persists. Now, what are the drugs which may not be available after February? Many diabetes medicines may run out of stock. There's likely going to be a scarcity of common medicines like paracetamol, as well as anti-inflammatory drugs and antibiotics. Along with this, the production of many neuropathic and cardiac medicines is also likely to be affected. Meanwhile, the government of India has identified specific drugs whose raw materials are produced in the coronavirus-hit central province of Hubei in China, and an alternate production plan is in the making. India's Finance Minister Nirmala Sitharaman will be meeting industry representatives to assess the economic damage of this outbreak. Now, the coronavirus outbreak is turning out to be more deadly because there is only little that we do know about the virus even now. Let's get to the details now of how this virus emerged in the first place. Take a look.
The reservoir of the new Chinese coronavirus, SARS-CoV-2, is an animal. And as in the case of SARS, active between 2002 and 2003, that animal is thought to be a bat. The virus is thought to have passed to a different animal, an intermediate host, perhaps a pangolin. The coronavirus was able to adapt and mutate and be transmitted to humans. Symptoms are fever and signs of respiratory infections like coughing, chest pain, as well as breathing difficulties, and in rare cases, diarrhea and vomiting. Experts have decided on a quarantine period of 14 days, but the exact duration of the incubation period is unknown. It could last up to 24 days. There's no vaccine or antiviral treatment against the epidemic caused by the coronavirus, which can be deadly, so only the symptoms are treated.